day. Welcome to My Health Cebu. I am your host, Dr. Seno, and we are back at Love Yourself Cebu, but this time at a different location. And I am joined again by the Cebu head of Love Yourself, Mr. Jan Vincent Estrada, or Jan Estrada. Okay, Jan, good day and welcome again to My Health.
Good day, Doc. Salamat sa pag-imbita.
Salamat sa pagdawat. Okay, I know na during the time of pandemic, these are different times. And then before the show started, I'm also glad to hear na nag-evolve sa inyong services. I'm very excited to share them already because having heard them, it seems as though it's very relevant. No, you went in the right direction, considering the restrictions of quarantine. Sige, so for our viewers who are not familiar with Love Yourself, Chan, can you tell them a little about your organization?
Okay. Sure, Doc. Love Yourself is a non-government organization, right, and it's also a community-based organization that focuses on HIV advocacy. So HIV education, HIV awareness,
offering HIV screening and also treatment. But actually, Love Yourself over the years has also evolved, not just offering HIV services. Love Yourself as an organization also includes now advocacies on mental health, also trans health, and also transgender advocacies or trans advocacies. So we become more of a more holistic advocacy.
Right. So so it's already July, no? So it just recently naman ang Pride Month, no? So I think these services are aligned, no, in support of the community of the LGBTQ++, Q++. No? Okay. It is inclusive. Okay, it's a fairly diverse community. Yeah, sige. So muna siya. So it's interesting na naapil na ron ang trans health, mental health. Ngayon sa patong the third one.
Trans health, mental health, HIV advocacy, sexual health.
I see, ano siya. So similar aligned gihapon, no, but na-extend din yung services. So siguro for this particular segment, no, of our show, so good siguro ta sa one, let's let them know that you transferred the location. So previously, the last time we spoke, tuamo sa capital area,
yes,
no? And now you transferred not too far away, in Lahog area, adjacent barangay,
yeah,
no? And then, how do they find this place if they need your services?
So actually, mas dali siya tultulon ron because now we are located at A. Morales Street, and it's actually at the back lang of Harold's Hotel. So it's easier. So just go to Harold's Hotel, liko lang mo diha na ay iskina sa Luyo, and then you will just see the signage of Love Yourself. And it's also a White House. Okay. Literal nga, White House.
Okay, katong ilang previous na location dito sa Lorente, no, sa capital area, is called the White House because it was a White House in the corner. Ako, I really like that location. It seems so very spacious, but this one is also very convenient. So, kung inyo nang pangitanong lugar na ay Ralph's diri sa usa ka ilang silingan, yung ilang pika silingan Nature Spring. Okay, so they're in the middle. Okay, so having said that, why the move?
Because back when there was at the peak of the pandemic, okay, so the location where we're in, it was going to be converted as a COVID laboratory.
Yes, I see.
Because that location is actually being given to us by Macare, which is the mother company of Biopath.
Right.
So, and because of in response to the pandemic, so the Biopath decided to convert it into a COVID facility.
I see.
Or not really a COVID
testing,
facility, but a testing facility.
Right.
So, wala mang gipahawa, but
for your safety,
for the safety,
and for your clients as well.
We want na medyo layo-layo ta
sa mga, sa testing. So we decided to move, okay? And I remember during that time medyo lisod because everybody was shut down, everybody was closed. So it's very difficult to look for a place, right? But then one of our volunteers, who happened to be also the owners of JEG, which is the owner of the gallery. So this is their old house, and they said that nabakante siya at that time. Nabakante siya recently. So they offered this to us, of course with a discounted price, and then they let us use this.
Okay.
And we saw the location, right? It's good. It's a White House then, so it aligned. So very opportune ang time ato. So we got this.
Good. Yeah. So this is a fairly recent move. No, fairly recent, but it all happened during quarantine. No, and yeah. So since extreme the quarantine, yeah, I remember before a new place mo, it's a place to go to. You made it so accessible and so welcoming, because you want the people to feel supported as they went in. No, so hindi lang siya for the LGBTQ AI plus community, but also for allies, no, and for people who are curious or want to find out more about the community. So in time of pandemic, di man na siya allowed, no? So ang inyong services has extended beyond the walls of your Love Yourself. So can we go through the things that have happened in the time of quarantine and how your services have evolved in response to that?
Yes. So aside from us moving to a different location, we also scaled up our services. So we offered new services in response to the COVID restrictions, given that nilimit ang mobility sa mga tao.
Right.
So number one, for our screening, since we know that people, it's going to be difficult for people to come here to the center for testing and screening, so we now have our self-care testing kits that we offer, where people can just order it online, and they can order a self-testing kit that's easy to use, so that they can test or screen at the comforts of their home, comforts and privacy of their home. And then also, it's actually a service. They're not just getting the kit, but also the service, because when they go online, they will be guided on how to use it. And if ever they need help, such as counseling, they can actually chat with a live person or talk to a live person via hotline.
Pero dyan again, no, so this is a screening test. Hindi siya ka ng confirmatory test.
Right.
But diba, mura mo ng pregnancy test, diba, na before you go to do your ultrasound or before you go to your OB, helpful yun kung na testing kit, no? So, unsa may, is it a sputum? Is it saliva? Is it blood? How?
It is blood. So, there's this lancet as part of the kit, pero there is a spring mechanism, so para mura siya gihapon katong inigana nimo kanimo retract dayon siya sa so it's very easy to use. It's small, it's easy to use, and it's disposable. You can throw it sa trash without any special na dispose
handlers in yung garbage. Okay.
So blood lang siya, and it's
box into a certain containers.
right. And once they have the results, they can actually tell us via chat. Also, they can get counseling when they give us the results. So if it's non-reactive, we give them all the options to prevent HIV infection, to make them stay non-reactive, and then if mo reactive siya, nalagay option dito to talk to a live person, so a counselor. They can chat, they can call, so at least dili gani siya like when you buy online sa mga Shopee or Lazada nya, you just get the kit and ikaw na bahala. You're right. Kanisha it's really the experience. So when you buy the kit, you are guided, and when you need help, you have access.
That's right. Yeah. How much is this kit?
The kit is actually $699, and that does not include the shipping. So additional shipping to Visayas in Mindanao, that will roughly be around $799. But since now we have a promo and it is being subsidized by one of our grants, okay, they can limited supplies, but naapaman last time I checked, so they can get this for free. Ang shipping lang ang ilahang bayran. So bali kung Visayas and Mindanao, that's 150 pesos lang.
There's no need to spend so much. Kahit libre na yun, ang inyo lang yung bayran, ang papadala na lang. Right? So, sige, so for our viewers who are watching, you can avail of this. Now, if you feel also that testing will benefit you and give you further support, then go ahead and contact Love Yourself natin yung location. Sige, so that's one of the services no, na natay testing niya. Kuman libre pag at this time. But kung dili gani, it's still very much affordable at $6.99. If they can pick it up, mas barato pa siguro.
Lisod. So for now, wala may option for pick up because ang ano mang good mindset na is if you're gonna pick it up here, might as well have yourself tested here. Diba? Anyway, our facility is set up to be very accommodating and set up so that discreet ang mong pagpatest. So if you're here na, patest na lang.
So if you might as well. Sige, so that's very exciting. Katong promo ng Hiskate dyan, no, it's even more exciting. Maybe we can talk about your other services. You mentioned to me earlier, just before we start, kanang express, no? Meaning inyo nang ipadala.
Yes.
Ang meds, okay?
So we also launched last year Express by Love Yourself. So this is available to Love Yourself treatment clients. So those clients that avail of our treatment services here at the White House. And actually, it's also available to all the Love Yourself centers. Instead of going here to get their refills, ARV refills, they can actually order online and then we will ship it to them.
So, sa may portal ninyo dyan, how do they go about? There's a Love Yourself website or
there is a online form that our clients fill out. So naa dito ang ilahang order, naa dito ang ilahang address, and then we will process it. We will send it via LBC. So they can either opt to deliver it at their address, or they can actually opt for us to deliver it in an LBC branch. Because there are people that live with their family and they don't want their medications to be known by their household members, so they opt to pick it up somewhere else.
Sige. Okay, so that has been a very exciting and fast-paced first segment here with Jan at Love Yourself Cebu. And as we come back, we're going to talk more about all of these new programs which are very exciting to me and hopefully to you guys. So come back and join us. Good day and welcome back to Mild Cebu. You're catching us at a conversation at Love Yourself Cebu with the head of Love Yourself Cebu, Mr. Vincent Estrada or Jan Estrada. Before we took a break, we were talking about the services that they are now offering during quarantine time. And one of them was Express by Love Yourself, which is a way for you to be able to get ARV medications and not having to go to the center anymore. So, Jan, we were talking during the break, and then we were telling that it is such a convenience to have that done. And it's so forward-thinking for Love Yourself to promote that kind of service. So, kana siya dyan, importante man kayo na di gud maputol ang ARV. And it's like your diabetes medications, it's like your cardiovascular medications. It's very important for the continuity of medications. And unfortunately, ARVs are something that you cannot buy at the local pharmacy. So, dili na siya madali-dali. So, there has to be some planning. And instead of taking the problem of commuting or looking for a location, you can actually go online and then take a few minutes just to make that order and make the whatever payments that are necessary, and then muna na siya, finish na. No, you don't even have to think about it. So, you're talking about the discretion of the package before we get into a break. So, how do you make it discreet? Why is that important, Chan, in terms of the packaging?
Because it is very important because most of our clients they're very discreet about their HIV status, right? So some of them, their family members don't even know that they are people living with HIV and that they are under treatment. So we always make it a point that when we ship out the medication, that it's in a discrete package. So we actually just put it in a brown paper bag with no labels or anything. So it's just a brown paper bag. And like what I said earlier, they can actually opt to have it shipped to an LBC branch so that they can pick it up. So that, you know, less risk for like their mama baron to receive it and then open it.
Okay, so honestly, they even thought of that. No, sila ka-thoughtful sila clients. Okay, so we've talked about Express, no, by Love Yourself. Now let's now talk about something that you told me as soon as we met this today. I found very exciting is the tele consults, no?
Yes.
Okay, and then it's called Icon, you know, by
Icon by Love Yourself.
By Love Yourself. So tell us what does Icon stand for and what is telemedicine in the context of Love Yourself.
So Icon is short for interactive consultation. So this is nothing new, right? Because even before we had this, there is already telemedicine. And telemedicine is, you know, when you consult a doctor online, diba? But I think this is one of the first in terms of or in the context of HIV treatment here in the Philippines. Because we found also during the pandemic that it's very difficult for our clients to travel. So, and if they need doctor's consultation, they don't have that option. And even now, well, just recently, diba, for you to be able to book an appointment with a doctor, you have to get swab testing, may mga ganun pa. So it's very difficult. So what we decided is, or what we came up with is to use telemedicine so that our clients can still get the medical attention that they need, but of course in the safety of their homes. And also, at least there is that, you know, social, physical distancing. That's
parang ako, it's really the next step. No, kanang in the time of COVID, we've all gone online. No, nya, it just makes sense for Love Yourself to occupy a certain space in terms of telemedicine. Ang inyong mga doctors, what are the usual consults that they deal with? No, so for those among our audience who are thinking na konsulta ka ako, how do they go about doing that?
So it's actually only available for now for our treatment clients. So those that are enrolled to Love Yourself. But most of the time, there are clients mong good nga, you know, niuli sa ilang probinsya, and then they might have like certain questions. Sometimes, most of the time, sexual health ang ilang concern.
I see.
So, kasi sila pangutana nilo about kanang mas lay na feel na
right
stretches ba ro,
right. So kana siya aligned with, like, say, for your clients with living with HIV, no, or for those clients who came to you for testing and things like that, or something like that.
And nasa ang mga clients but usually kanang mga newly diagnosed and then they just newly started their ARV medication, naapod na siya. Of course, nasa yung mga side effects nga ilang ma-feel, so they can also use Icon to consult a doctor regarding that.
So, you mentioned earlier, Jan, di ba, na before I forget, no, although this is medyo tapsing gamay, no, you were talking about mental health as part of the extension services of Love Yourself na was not initially there but recently become incorporated with your brand. So, do you also provide that kind of support online?
So, it's actually being spearheaded now by a team in Manila. So the mental health arm of Love Yourself is called Flourish, right? And in the time of pandemic, they actually and even now they have schedules for what we call a circle. So meaning it's a and they have a lot of online programs wherein people can enroll and then people can meet on certain times and then they can have guided and facilitated discussions on you know, mental health.
Right. No, so
it's very difficult sa time of pandemic. Some people really hard at home. So at least even online, there's some avenue for them to express themselves, to get help.
So, nagid na siya link kanang chronic disease and mental health. No? So, people who are struggling with a chronic disease, even if it is HIV can really live with it, but I can imagine at the beginning it can be very overwhelming, and that can lead people, especially those with a genetic predisposition, to go into major depressive disorder. And yeah, part of that struggle is also anxiety, and then it does help to have a community that understands you, not just that kind of the medical support that's warranted, because in some cases you do need medication for that. So ang inyong teleconsult also provides for that. Nakinta, if they feel as though that it's necessary for this individual to receive medication, na ability to make a prescription.
Yes, pero not sa mental disorders, but for katong ilang like medication for their
Kasi among telemedicine.
sa amo lang medical doctor, which is mostly specializing on but for the mental health piece, katong sa Flourish namo, it's more on just a support mechanism for those who are having difficult time dealing with anxiety. But also, during the discussion, if the facilitator deems it na baka you need help, we also have a referral mechanism.
Right.
Or he can get the appropriate intervention.
Right. Okay. So, what are the changes? So again, let's for those of you who are just joining us, we're talking here at Love Yourself Cebu at their new location in Lahog. Again, a very convenient place. We've talked about Express. This is a way for you to get your medications. And then we've talked about Icon. It's again telehealth. Again, very important during this time of quarantine. And then very briefly, we talked about Flourish. So, is there anything else that we failed to mention dyan now?
We also launched Transcend by Love Yourself. So it's
for the trans community.
For our trans brothers and sisters.
Okay.
So, aside from HIV and sexual health, we feel that also we can do more for the trans community. And
part of Love Yourself's efforts is to have a trans health clinic. So we already have one in Manila, at Victoria in Pasay, and we are now starting another. We're now starting to
offer trans health services also to one of the Love Yourself centers in Taguig. Taguig Paranaque area.
Right.
And then eventually we will have that in Cebu.
Okay.
Because we feel, of course, that the trans community have their own needs.
Right.
Very particular to them. And
as part of the LGBT community, of course, it is also our responsibility to help them out. And
we have volunteers that are trans women.
And I think Love Yourself Mungod is very well suited to do that. Okay? Again, you guys started off with just HIV advocacy, HIV testing. Right now, you're very supportive of the community. Importante kaning trans kay it's a community within a community.
True.
And then they are the most prosecuted, I feel. I remember reading this Time magazine on the trans community. I tried to understand gender, Manggod. A lot of them try to commit suicide. There's a increased risk of depression, anxiety because they're outsiders among outsiders. So importante yung kaya. We really want to support everybody, and including the trans community. So, what is the curriculum in supporting trans? So, what does Love Yourself plan to do for the trans community?
So, we plan to provide the trans health services. So, we will offer gender-affirming hormonal therapy to them. So, at least it's because a lot of our trans sisters and trans brothers, they transition without medical supervision.
That's right.
So, dahil yung mga health concerns.
So, at least with Love Yourself offering GAT or GAHT, at least it's gonna be under the doctor's supervision. So,
at least it's gonna be done safely.
Safer. Sakto sa dang dosages. At the same time, mas cost effective because kanang magong uban, no, when they try to transition, no, they feel as though that they want to have a bigger chest, no, or softer skin, no, they will do hearsay. No, kung sa may gibuhat nimo, let me take that as well. Yeah, it can be costly. Kaya you spend so much and there's no effect. Oh, yeah, actually, you may suffer instead from side effects, and that you're going to treat further. Numurog cyclical siya, but wag po effect, no? Okay? Yeah, it's so good to hear na naanay gender correction na treatment, no? So, no, gender assignment. Affirmation. Okay, the term used, there was an older term, no, kanang gender correction, no? But right now, the more acceptable term is gender affirmation. No?
So you're affirming the true gender of a person.
That's right. No? Meaning you know that you are, and then the surgery itself, no, confirms that. No? So it doesn't correct anything. There's nothing that needs to be corrected. It just has to be affirmed. No? So I think that's such a positive term to use. No? So again, that's called transcend.
Transcend by love.
Okay. So as we were saying, no, I really like the names of your programs. No, it's so exciting for me now. You have Icon, you have Express, you have Flourish, and then lastly you have Transcend. No, they're all very positive terms, and I hope that they do catch on, and I hope that people will accept them. So far, how has the reception of that particular service been so far? Transcend.
Yeah.
How big of a community do you currently support?
For now, kasi we just started this year for Cebu. And actually, the head of Transcend, si Elaine, we just had a meeting the other day, and I actually told her that, your efforts are paying off, because before, wala dyan magpa-test din na trans.
Okay.
And then, when they started with their campaigns, because we don't have the gender affirmation hormonal treatment or hormone treatment dili sa Cebu just yet.
Yes.
So more on campaigns lang dili sa Cebu. But we already saw na dagan ng mga trans sisters and brothers na magpa-test dili.
Okay.
So, I told her na that's good, because we started off with 0. Last month we had 3 people who tested, and then now we now have 8. So I mean,
exponential.
Exponential. Because actually, malipay na ganito kung makaabot may of 10, 15, because that means that we're reaching out these people, and once they avail of our services, matatag naman good.
I agree. Sige. So again, we need to take a break. We're in the middle of discussion about support for the trans community at Love Yourself. So join us again and we'll talk further. Okay, welcome back. You're joining us here at Love Yourself Cebu at the show of My Health Cebu with your host, Dr. Steven Seno, and I am joined by my guest, Mr. Jan Estrada, the head of Love Yourself Cebu. And as we took to a break, we were talking about trans health. No? So trans health is not just mental health. No? Now, although there are they have an increased risks of depression and anxiety because of the confusion that they're going through, and also from the persecution, and possibly due to a genetic predisposition for some families or for some individuals. And then part of that also that they hope to provide in Cebu eventually, is the gender affirmation therapy, or GAT. So so Jan, that's in the pipeline, ang GAT, ang GAT. So how soon do you think that the Cebu community can avail of GAT?
So we plan to have it by the end of this year or early next year.
All right. Yeah, you're going to be the first, na NGO offering that kind of service, to the community. Okay, so very affirming. It's good to hear na wala lang dito sa Metro Manila, but possibly even outside Metro Cebu, to Metro Manila kamo ang first, to provide that kind of service. Sige. So so many things under one umbrella, one flag. Okay. What are the? Let's go back to your core. Your core is HIV. How has HIV been? From NGO dealing with HIV and its support. What's my perception? What are the numbers now with regards to prevalence and incidence in the time of quarantine?
So actually, in the time of quarantine, now with the numbers. So if I'm not mistaken, around 590 lang here in Cebu last year.
Okay.
Around that.
Is that like half of what it used to be?
Dito lang ka?
1/4? Okay.
Mga ganon.
Okay.
Tapos before, mga siguro in a year, siguro mga 3,000 siguro pa.
Okay, wow.
I just don't have the exact figures.
Right. Somewhere there, no?
Pero, given naman na, actually, we've already anticipated that because of the restrictions. So
Right,
when there's when the restrictions were placed, lumera din naman pa-test.
Right.
But now we've seen that the testing has increased, and also that means that we are also the cases that are being recorded has also increased. So we're now seeing and we are slowly normalizing na.
Okay. So, usa na sa mga kanang casualties of COVID-19, no, na as everybody is so focused on being safe from COVID-19, and for those who are affected being treated by it, so many other diseases, chronic diseases have been neglected, which includes HIV. No, and it's so fortunate that there's an organization or an NGO such as Love Yourself, which has evolved, has responded to the call of quarantine, and has come up with all of these programs, including telehealth and express health. Express by Love Yourself, which is delivery services. Okay, and then incidence has gone down, but possibly because of a lack of testing. But as the numbers, as people are beginning to relax and beginning to come back to medical services, it will truly reflect. But again, usa na sa mga barometers of the success of the NGO. Is if the numbers truly go down, it means that the advocacy, the testing, and all that is working. I read somewhere na during quarantine, during the strictest of quarantine, had everybody been tested, mahuman na to atong spread, because di ba naman ang incubation period, so had people just stopped at the time, having contact and gotten themselves tested, na considering din katong lag gani of not being able to be detected, mas in-identify ng tatutunan, and our numbers would have gone down dramatically. Okay, what na sipyat, everybody would have already been tested and the status would be identified, and hopefully also gaamping na gatuman na sa medicine if necessary. Okay, so we've talked about this being a volunteer program. It's run in large part by volunteers. So are you still accepting volunteers for this year, Jan, or you're good to go?
Actually, we're still thinking if we will accept volunteers, but constant manggod ang registration for volunteers.
Right.
So on our Facebook page, we have our link to where they can register. And if we have an intake of volunteers, then we call those people who register.
Okay, during the time of quarantine, I guess some of us are already going back to atong normal program, but during the time of quarantine, one of the things that could help you with relieving your anxiety and ang imong isolation is to help others. And then perhaps that we had this program at the beginning of quarantine, then perhaps more people have volunteered. Kay ang kanang spirit of volunteerism ni gawas man gyud siya during quarantine, during the time of COVID-19. Sige, but again, although we are at the tail end, of as people are getting vaccinated, you can still, if you feel as though this is something that you want to help out, as with the many programs that Jana shared with us today, then please get in touch with them through their Facebook page, or Love Yourself through Instagram. They also have you have an IG page, Yeah, that's also something you can access. Sige. So, what are you looking forward to, Jan? We're at the mid-year. We've gone through a year and a half of quarantine. We're hopefully about to exit. As people are getting vaccinated. What are you looking forward to in 2021?
So, for 2021, I'm very excited. People now are going out. People now are getting vaccinated, of course, safely. So at least now, because that we had launched all these new services, we will still be continuing it despite, regardless whether it is COVID or not.
Right.
And I'm very excited to see how that goes when COVID is not anymore a threat or an issue, and then we still have those services. I think that once situation is regular, it's now normal, and we have those scaled-up services. I think that I hope that people will still continue to use it, and if they haven't, they try to use it. So at least we get to increase more our numbers in terms of screening. We get to help more people, whether non-reactive or reactive, on results. So, and also very excited with our trans program.
Ako sad. I feel that's very dynamic. Importante kayo na siya.
It's something that we always, like what you said, Doc, we neglect, even within the community, we neglect the needs of our trans sisters and our trans brothers. So at least now that if they have this service that they can use, at least, they, number one, they feel that they are being seen,
right?
And number two,
right. Or madaot imong atay, madaot imong kidney, or and then long term na siya. So at least kung naay guidance, murag dili, you're not on your own. No, you don't have to rely on a YouTube video in order to get your gap. Okay, diba? So nagi kay guidance pa niya. Kung doon na kay gibating may side effects, basin magamit ka sa ato ang icon eventually, So kana siya, I feel as though na as we exit this time of isolation, ang in your portfolio of services ni doble, no? Kay apart from yung mga face-to-face services which are ingrained and will continue and resume possibly in the numbers prior to March 2020, napigid may complement na will continue to exist. No, so mas daghan niya, basin ba you will need more volunteers, no? Okay, although naka-training naman mo, no? So ato lang i-review ha. So if you do become a volunteer for Love Yourself, there is training involved, right?
Yes.
No.
So we offer orientation for the volunteers, and then depending on where they want to focus on, if they want to focus on HIV, or if they want to help out with Flourish, which is a mental health arm, or if they want to focus on Transcend, which is for our trans community, they can actually tell us where they want to go so that we can train them depending on where they want to.
So mas ganing ng the versatility of the services that you can volunteer for, no, na kanang 3 years ago when you first spoke dyan, wala pa ni. HIV naman ko focus nato. Pero karon evolve na gid siya. It really is encompassing of so many services niya. Very exciting ang kanang, especially kanang GAT na gender affirming na therapy.
And I also want to also share na if there are organizations out there and companies out there who also want to avail of mga services na mo, mental health, HIV, or whether trans, or trans na services, or SOGI services,
yes.
they can also contact us.
Right, no, I forget that.
We can also do that to if they want a seminar on SOGI, we can do that, whether online or safely, physical distancing.
Right.
It is a mental health.
Right. See, so much. So much to love about yourself. No? So, kana siya, again, no, na-surprise ko sa versatility sa services yun sa Love Yourself. No? I feel na itong, kana, no, if you have a company or you're part of an organization, you want to understand it more. So the topics that you can choose from may include understanding people with HIV, people living with it, or understanding the trans community further and the services that they may need, or even talking about SOGI, the equality bill, no? So, if it's something that you want to learn and understand, and not just for yourself, but for the community or organization that you belong to, you can contact Love Yourself. And that, again, is part of their growing portfolio of services that they provide. No? So, I hope that this has been very helpful to those of you who have been listening. So, how's it been? How was the last... you've been in the head of Love Yourself Cebu since 2018, okay? And we're fast forward to 3 years later. How's it been? How has it evolved? How has the reception of Cebu been to you or to the community, to Love Yourself?
Actually, the reception has quite been positive. Very difficult, I would say, for the majority, for the most part, because of COVID.
Yes, no? Grabe.
But aside from that, it has been a positive experience for me personally. It's very nice that the community and even people outside of the community has helped Love Yourself in one way or another.
Right. Okay.
May mga tabang na nakuha along the way, which led to this, our services getting expanded.
Your second home.
Yeah.
Second
Without our sponsors, our partners, we wouldn't be able to.
And the strong spirit of volunteerism that you
That's
yourself.
true. The volunteers especially, they are the ones that has been, the driving force in making Love Yourself what it is today.
That's right. No, so Ganesh, it's such a positive and beautiful story, and especially we need that during these times, no, na, to understand that people are really helping each other, no, and in so many ways, and not just in the COVID-19 effort, but also in advocacy of so many ways, of so many things. As we come to a close, no, to our very informative and information-filled episode today, I would like to give the floor to our guest, Mr. John Vincent Estrada, or John Estrada, our head of Love Yourself Cebu. So John, please address our audience and give them a few pointers, a few of your thoughts for this afternoon.
Yeah, I would like to invite everybody to come over here in Love Yourself White House, because again, and see, try to see our new community center and try to avail of our services. And also, if you can't do that, let's say you are far away from the community center, you can always visit our Facebook page to know more about our services, all the services that we offer. So if you need testing, you can still get tested even if you're not physically in our location, and all the other services that we have. And also go to our website as well, loveyourself.ph, to know more about the different services that we have nationwide. Because aside from Love Yourself or the Love Yourself community centers, we also have partner community-based organizations that could be near you that you can also get services from.
Okay. So John, thank you. So well expressed. No? And it makes me so excited not to know that Love Yourself has survived COVID-19, and not just survived, has actually thrived. No? And to borrow one of the words that you used, flourished.
Yes.
Okay. So John, thanks again for having us, and we look forward to your success and visiting Love Yourself in the future as you continue to evolve and provide more support for the community. So in behalf of Joel, Randy, our crew here at MyTV Cebu, we thank you for joining us, and we hope that you learn so much about Love Yourself and the support that they provide. Stay safe, Cebu, and I'll see you soon.